Things over to John.
On this Wellness Wednesday, we're asking, are you turning a blind eye to complications of diabetes? More Americans face the risk of vision loss and blindness than ever before, particularly those living with diabetes. It's actually the leading cause of new cases of blindness among adults aged 20 to 74. With that, Dr. Ivan Sunier joins us to explain. Dr. Sunier, thank you so much for joining us. We appreciate it. Why are we seeing such a rise in vision loss?
Thank you for having me. Well, we're seeing a high increase in vision loss because diabetes itself is growing at an exponential rate in this country. There's currently about 26 million people in this country alone that have diabetes, and out of these, about 500,000 have the blinding condition called DME.
And what exactly is DME, doctor?
DME is diabetic macular edema, and it's caused by leakage of the small blood vessels in the retina. And this leakage over time causes swelling, which distorts the vision. And this over time can also cause blurring, loss of patches of the vision, and can lead to permanent visual loss as well.
So what's it like for people who have that condition, DME? What do they see?
Well, the interesting thing with DME is that initially they may have no symptoms at all, which is why it's so critical to be seen at least once a year for a dilated eye exam by their regular eye doctor. But then over time, as the leakage progresses, they can have distortion, they can have double vision, and they can have patches of permanent vision loss.
So we know some of the symptoms now, but who is at risk for DME and what should they do to help prevent that?
Well, pretty much anybody that has diabetes is at risk for DME. The longer you have diabetes, the higher your risk. Also, it's important to control blood pressure and control the blood sugar, which is why it's important to work closely with your physician. But then the most important thing, again, is being seen at least once a year for a dilated eye exam to help pick up DME early on, which is a preventable cause of vision loss in mostly working age Americans.
You mentioned that it's preventable, but if someone does get diagnosed with DME, are there treatments to help patients with that condition?
Well, there's been an exciting new therapy called Lucentis, and that was recently FDA approved, and it's the first drug approved by the FDA for this serious condition. And in this study, it showed that more than half of the patients treated can regain vision good enough to drive, 20/40 or better, and about 40% had significant visual improvements of more than 3 lines on the visual acuity chart. And this is, again, the first FDA-approved drug that we have now for this serious eye condition.
There's certainly great progress being made. Where can patients that might be watching this here in the Low Country go to get more information about that drug or the condition?
Well, the most important source of information is your regular eye doctor. But for more information about this exciting new therapy, the best source is Lucentis.com.
All right, doctor, thank you so much for your time and your insight. We appreciate it. And we'll be right back with more Low Country Live in just a moment.